Massachusetts, home of Harvard, Dunkin' Donuts, and crippling healthcare costs. Yeah, that last one doesn't exactly sound awesome, does it? But it's the reality for too many in this state. We're talking about families struggling to afford life-saving medications. Seniors forced to choose between rent and doctor's visits. Small businesses getting crushed by insurance premiums. It's a system that's broken, and we've all paid the price. But here's the thing. It doesn't have to be this way. Massachusetts has a chance to lead the nation once again to build a healthcare system that actually puts people first. And that's where single payer comes in. Imagine a Massachusetts where healthcare isn't a privilege, it's a right. Where access to doctors, hospitals, and medications isn't tied to the size of your bank account. That's the promise of single-payer healthcare, and it isn't some crazy dream. It's a real, concrete proposal on Beacon Hill to create the Massachusetts Healthcare Trust. If made law, this trust would fundamentally change the way healthcare works in Massachusetts. It would create a single publicly funded system that covers everyone in the state. That means no more insurance companies, no more co-pays, no more deductibles. Just straightforward, accessible healthcare for all, as it should be. So who gets to enjoy this healthcare utopia? Pretty much everyone who calls the state of Massachusetts home. Every man, woman, and child, regardless of their income, employment status, or pre-existing conditions. And it won't matter if you were born here or moved here. If you live here and intend to stay, you're covered. That means no more worrying about losing healthcare if you switch jobs or have your hours cut. This is healthcare that's truly universal. No worrying about fine print, loopholes, or unfair denials. Just quality healthcare for everyone who needs it. You know, all those co-pays, co-insurance, and other out-of-pocket expenses anytime you need a doctor? Well, you can kiss them goodbye, because under single payer, they're gone. That means not putting off a doctor's visit because you can't afford the copay. That means not skipping an important medication because your insurance won't cover it. That means not facing financial ruin because of a medical emergency. This is healthcare the way it should be. Simple and stress-free. As you can see, single-payer healthcare is awesome. But how are we going to pay for it? That's the million-dollar question. Fortunately, it's an easy question to answer. Funds will come from a modest payroll tax, along with state and federal funds. I know no one likes the word tax, but hear me out. While a few at the top could see a slight increase, most of us will save money. We'll no longer be shelling out for co-pays, co-insurance, or premiums, and our hospitals won't have to deal with insurance bureaucracy. Studies have shown that single-payer healthcare would save Massachusetts billions of dollars each year. That's right, billions. Now, let's not sugarcoat things. Implementing a single-payer system won't be a walk in the park. There will be challenges, roadblocks, and naysayers lurking around every corner. One of the biggest hurdles will be overcoming opposition from special interests like insurance companies, who stand to lose a lot of money under a single-payer system. They'll fight tooth and nail to protect their profits, even if it means sacrificing the health and lives of millions of people. But here's the thing. We can't let them win. The stakes are too high. We need to stand together, raise our voices, and demand a healthcare system that works for everyone, not just the wealthy and well-connected. Despite the challenges we'll face in getting this passed, the benefits will be worth it. We're talking about a healthier, more productive, and more equitable Massachusetts, where everyone has access to the care they need when they need it, where families no longer have to choose between putting food on the table and seeing a doctor, where small businesses can thrive without the crushing burden of healthcare costs. That's the promise of single-payer healthcare, and it's a future worth fighting for. The fight for single-payer is about more than just policy. It's about justice. It's about ensuring that everyone, regardless of income or background, can live a long, healthy life. So, what can you do to help get this done? Contact your elected officials, talk to your friends and family, and spread the word on social media. The more we demand change, the harder it will be for our leaders to ignore us. This is our chance to make history, Massachusetts. Let's seize it.